Good afternoon to our Union City residents and staff, and our community members. I hope you are feeling healthy and doing well today. You probably received a short robocall yesterday to give you the news that a resident in our Lorber skilled nursing facility had passed away that morning due to COVID 19. Since this is the first death that our community has experienced since the pandemic due to COVID 19, I wanted to reach out today to you with this message. I am, of course, heartbroken by this news. It doesn't make it any easier that the resident had pre existing and underlying condition. The family was notified, and they were there to help make the end of life decisions for our resident, who was, just as you all are, a member of our Masonic Homes family. Our hearts and our prayers are going out to the family at this very difficult time. I can't emphasize enough how much this pandemic has changed us all. It's changed our daily lives in almost every possible way. Our work and life here at the homes is different. It is more difficult and stressful in so many ways. This pandemic has taken its toll on all of us. Our staff, especially, is under an unbelievable amount of stress. But also, I must emphasize that our policies, which have recently become stricter, have helped to keep our campuses mostly healthy for months. And now, as we see caseloads rise exponentially throughout California, we're seeing the virus enter our doors and spread as well. We have had more positive tests for COVID 19 since Thanksgiving than we had in the first 8 months combined. We currently have 22 active cases among staff and residents on our Union City campus. This is a serious call to action. Our policies and our procedures are more important now than ever, and we must be incredibly vigilant now. To our staff, you must follow the policies. If you are confused or you don't remember them, please ask your manager. But two of the most important policies are you must wear your mask at all times, except when eating and only in designated areas. And of course, you must not come to work if you are feeling ill at all. Let me reiterate that. You must wear your mask at all times, and you must not come to work if you are not feeling well. We have the resources to support you in many ways to help you through this, but you must comply with these policies and procedures. And to our residents, you also must follow the policies and procedures as well. All of you, even me included, are in high-risk populations, and it's critical that you wear your masks, that you stay 6 feet away from others, and that you wash your hands. And we follow all the other policies that we've put into place for our health. I cannot stress enough how important all this is. Staff and residents who do not comply with our policies, well, we're putting the rest of the community at risk. We can't have that. The rise in the number of COVID 19 cases is scary for all of us, and these past few days have been the hardest so far. The news, I'm sure, came as a shock to many of you that we lost a resident, but it's also a great reminder of how precious life is and how we must do everything we can to stay healthy for ourselves and for the residents we serve. You can't serve residents or be there for your own families if you don't feel well yourselves. And so, to help with this, we are holding a couple of emotional wellness drop in sessions so that you can, well, talk, where you can talk about your concerns and get some advice. And I strongly encourage you to attend these, especially for our Lorber staff who've been hit so hard in the past few weeks. Your administrator, Cynthia Cruz, will be working with MCYF and Human Resources to plan these sessions so that you can take advantage of them. The rest of us can also access time with MCYF. Just talk to the front desk and schedule an appointment. And let me be frank, we need you, all of you, to make good decisions and prioritize your health, both your mental health and your physical health. These resources are here for you, so please, I want you to use them. And I'm so sorry to break this news, especially when we are so close to having the vaccine, that is going to make this burden so much lighter for all of us. But we want you, more than anything, to keep this virus at bay for just weeks longer. If you have questions about the vaccine, please reach out to your manager or Human Resources or Joseph Pritchard. They're here to help you make a good decision for you and your family. This vaccine is going to be the light at the end of this tunnel, and it is coming, I assure you. We'll update you as soon as we have more information about when it will be available to us. And I know it's been frustrating because we expect the vaccine next week, and then we're told the week after, and then we're told the week after. But I can assure you that this vaccine will be here, and it will be available to us. And it won't be months and months from now. It's going to be weeks. At the longest, it'll be weeks. I leave you, though, with one last thought. This pandemic has been difficult, but I also hope it has helped us focus on those things that we continue to be grateful for, and also why life is so precious to each and every one of you. I'm so grateful for our staff and for our great residents, for the efforts you've made for so long. But as I've said, we're going to get through this together and we will be stronger for it. So buckle up for the next couple of weeks. I can't be more serious about this than I am right now. So wear those masks, keep that social distance, wash your hands, stay home, and quarantine if you feel sick at all. Follow the safety policies that we put in place and these procedures. It's never been more important than it is right now. And as always, I leave you with my heartfelt thanks for all that you've done and all that you will continue to do. So, God bless to you and to your families. Take care of yourselves. Good afternoon.